Welcome to the Living Tobacco Free Training module brought to you by the Washington Wellness Team at the Washington State Healthcare Authority. By the end of this training, you will have a greater understanding of the health and economic costs of tobacco product use, Washington Wellness's tobacco prevention and cessation strategies, the tobacco cessation benefits and resources available to employees and their family members, and how tobacco and vaping cessation and prevention can be included in your wellness programming. We want to start off by emphasizing that it's not just about cigarettes anymore. There are numerous options on the market to ingest nicotine, the primary addictive substance that is found not only in cigarettes but also cigars, pipe tobacco, chewing tobacco, and more. With the onslaught of electronic nicotine delivery systems like e-cigarettes and vape pens, the tobacco landscape has changed dramatically. Some products are made to look like regular cigarettes, cigars, or pipes, and there are larger devices such as tank systems that do not resemble other tobacco products at all, more closely resembling pens, USB sticks, and other everyday items. The image on this screen depicts a variety of nicotine delivery devices, highlighting the wide range of appearances. Given this ever-changing list of product options and the health and economic impact of tobacco and other nicotine products, it is now more important than ever to increase awareness, provide education, and promote prevention and treatment for nicotine addiction. Yet, in spite of all of these new nicotine innovations, cigarette smoking remains the leading cause of preventable death and disease in the United States. A few fast facts that highlight just some of the major health and economic impacts of smoking. Smoking leads to disease and disability and harms nearly every organ in the body. Smoking is responsible for more than 480,000 deaths per year in the US. The total economic cost of smoking is more than $300 billion each year. The tobacco industry spends billions of dollars each year on marketing and advertising. Approximately 11.6% or 28.8 million US adults currently smoke cigarettes, 10.1% of women and 13.1% of men. And each day, almost 2,500 children under 18 years of age try their first cigarette. Now let's take a look at some of the most recent data we have on the health and economic impacts of smoking in Washington. About 13.5% of adults and 5% of youth currently smoke cigarettes. Cigarettes and secondhand smoke cause 1 in 5, or 20% of deaths. Over 100,000 youth alive today will die prematurely from smoking. And nearly $3 billion in annual healthcare costs are attributed to smoking. But again, it's not just about smoking cigarettes and using other tobacco products. The tobacco companies and other e-cigarette vendors will continue to strategically produce and market an array of e-cigarettes, including vaping products. Additionally, they will continue to modernize their products, expanding the options of nicotine addiction and contributing to the overall youth nicotine use rate. This helps ensure the next generation of addicted adults, thus also ensuring long-term consumers of nicotine products. The image on this screen shows the evolution of vape products. First generation disposable e-cigs, second generation refillable cartridge e-cigs, third generation refillable tanks or mods, and the fourth generation pre-filled or refillable pod mods. This graph shows Washington youth commercial tobacco use trends in 10th graders from 2004 to 2023. Prior to the advent of e-cigs and vapes in 2012, smokeless tobacco product usage hovered around 5 to 7%, and cigarette usage around 12 to 15%. From 2012 to 2020, cigarette and smokeless tobacco use declined to a combined 7%, but e-cig and vape usage skyrockets to around 17% in 2014 and 2018. This data is not directly comparable before and after the onset of the pandemic due to large-scale survey format changes, but the data we do have is still concerning. For example, of the 10th grade students who vape, nearly half of them vape more than 20 days in the past month. The long-term health effects of vaping could take decades to understand. We do know, however, that nicotine addiction is still a present risk. Some short-term health impacts include vascular cell damage, increased heart rate and blood pressure, and increased coughing and wheezing. Other health risks and unknowns we need to continue studying include explosions or burns, nicotine poisonings, the impact of vaping on youth brain development, safety testing certain chemicals when inhaled versus ingested, and mental health concerns related to vaping as a coping mechanism and means of stress management. The image on the right of the screen states, "Don't be a lab rat, don't start vaping." Vapes contain many harmful substances, such as an addictive chemical called nicotine. Nicotine can harm parts of the brain, particularly in young people. Some vapes contain as much nicotine as a whole pack of cigarettes. Vapes contain batteries which can explode, causing serious injuries and burns. Young people who vape are usually more likely to smoke cigarettes in the future. Now let's take a look at the impact of tobacco and vaping in the workplace. There are two types of employer costs to consider caused by tobacco and vaping use at work. Direct costs are those dollars spent on health services. Direct costs include payments made by the company for healthcare benefits, disability, and workers' compensation. Indirect costs are expenses not immediately related to treatment of disease. These include lost wages, lost workdays, costs related to using replacement workers, overtime expenditures, productivity losses related to absenteeism, and productivity losses of workers on the job. These costs for Washington State add up to approximately $6,000 per year per tobacco using employee, $4,000 in lost productivity, for example, smoking breaks and absenteeism, and $2,000 in excess healthcare costs. Tobacco and nicotine prevention and cessation continues to be a priority in Washington Wellness's yearly strategic planning. We craft our strategies with our member employees' tobacco prevention and cessation efforts in mind. Each year, we develop promotional materials to increase awareness of the issue and its impacts. We provide education, toolkits, and resources to wellness coordinators to support their promotional efforts. We also promote the tobacco and nicotine prevention and cessation benefits available to employees and their eligible family members. So, what is the most effective approach for promoting tobacco prevention and cessation in the workplace? According to the CDC, it's best to integrate multiple approaches that include programs, policies, benefits, and workplace environment. Specific examples may include communications or media campaigns, classes, smoking bans and restrictions, clinical and telephone quit line referrals, cessation benefit coverage, and other related activities are more successful in reducing workplace tobacco use than any single intervention alone. Here are some things that wellness coordinators can do to integrate a multifaceted approach. Promote PEBB and SEBB cost-free treatment benefits. Create supportive environments for quitting tobacco. Promote cessation incentives like smart health and lowering healthcare costs by dropping the tobacco use surcharge. Educate employees by sharing information about emerging issues. Implementing the campaign for World No Tobacco Day on May 31st each year, and promoting the Great American Smokeout the third Thursday in November annually. Now let's look at the tobacco cessation benefits and resources available to employees and their eligible family members. The PEBB and SEBB program insurance plans offer a variety of tobacco cessation support options, including, but not limited to, phone, video, or chat-based health coaching, nicotine replacement therapies, and counseling. For details on your plan's specific tobacco cessation offerings, you can visit Living Tobacco Free for PEBB or SEBB, visit your plan's member portal if applicable, or call your plan's customer service line. Other tobacco cessation support options are available to different populations in the state of Washington, including, but not limited to, the following. The Washington State Tobacco Quit Line uses a cognitive behavioral therapy approach that includes counseling and medication. It's a resource for the uninsured, underinsured, and those who have Medicaid coverage. Another program connected to the Quit Line is Live Vape Free, which focuses on supporting parents and other concerned adults. This online learning program is designed to provide helpful insights, tips and tools, and resources for ongoing support. This includes chat and email-based support and online content that prepares parents and caregivers to kickstart the conversation with teens about vaping. The Washington State Department of Health also provides the Tomorrow Health smartphone app that includes two programs. Smoking and Tobacco, a program for people who want to quit smoking or other tobacco use, including a special program for pregnant individuals, and Vaping Age 13 Plus for teens and young adults who want to quit vaping. Older adults who want to quit vaping but who do not smoke can also use this program. The X program from Truth Initiative is a flexible program that evolves with you by helping you change your patterns, find support, and explore nicotine replacement therapy. And finally, Smoke Free offers several programs for general support, veterans, women, teens, and Spanish speakers. Smokefree.gov includes live online chat with trained counselors, text and app-based support, tools to build a quit plan, and more. It's also important to mention that if a dependent age 17 and under enrolled on your PEBB or SEBB medical coverage uses tobacco products, your plan may have specialized offerings for youth. Contact your plan to learn more. On the Washington Wellness Living Tobacco Free PEBB and SEBB web pages, we provide additional resources and ready-made toolkits to help support your tobacco prevention and cessation promotional interventions in the workplace. Visit hca.wa.gov/tobacco-free or hca.wa.gov/tobacco-free-SEBB to view and access available resources like the digital signage displayed on this screen. And here is one more example of the types of digital signage and other materials you can find on the Living Tobacco Free web pages. Thank you for your time and interest in learning about the impact and outcomes of tobacco and vaping use and how to implement prevention and cessation efforts in the workplace. Please reach out if you have any questions or comments by emailing or calling Washington Wellness or contacting your individual health promotion consultant. Be well.